So now we're going to start the infratemporal fossa and its contents. Okay. Now, first we have to know the boundaries of temporal fossa so that you get a clear idea about the infratemporal fossa. See, temporal fossa, see the diagram. So this is a side view of the skull. You are seeing the skull from the side, the lateral view of the skull. Okay. Now, in the lateral view, we are seeing one line here, that is the temporal line. There is a temporal line. Okay. And below the zygomatic arch, that is the zygomatic arch. Now, between the temporal line above and below zygomatic arch, now we have this space. I'm talking about this space. Now, that fossa is called temporal fossa. Okay. Now, in the temporal fossa, only one muscle will take origin, and that muscle is our temporalis muscle. Okay. So, the temporal fossa, we have only one content, that is our temporalis muscle, takes origin from the temporal fossa. Now, I told you the lower boundary for the temporal fossa is the zygomatic arch. Now, below the zygomatic arch, we have a space. That space is present below the temporal fossa. So, that fossa is called infratemporal fossa. Now, see the diagram. Now, in this diagram, we are seeing the inferior view of the skull. We are seeing the skull from inferior side. Okay. Now, this is our zygomatic arch. The line, dotted line, we are seeing now. Yes, that is our zygomatic arch. Now, below the zygomatic arch, below the temporal fossa, we have infratemporal fossa. That is the point. Clear? Now, what is the exact boundary of the infratemporal fossa? Now, see this diagram. Now, again, we are seeing the side view of the skull. Now, the boundary, infratemporal fossa boundary, the lateral boundary will be, see here, I told you zygomatic arch and this infratemporal fossa. The lateral boundary, this is lateral boundary, lateral side, and this is medial side. Okay. This is medial side and that is lateral side. Now, laterally, we are seeing this bone. What bone? That is the ramus of mandible. So, infratemporal fossa, the lateral boundary will be ramus of mandible. So, we are adding the boundaries of infratemporal fossa. Infratemporal fossa boundaries we are writing. So, the lateral boundary will be ramus of mandible. Okay. Right. Ramus of mandible. That's the lateral boundary. Okay. So, this is the lateral boundary. So, now the second diagram, we remove the ramus of mandible. Okay. And we are seeing this one. Now, this is the medial boundary of the infratemporal fossa. Now, in the medial boundary, we are seeing one plate. That plate is called pterygoid plate. And we have two pterygoid plate. One is lateral, another one is medial. Now, the plate, what you are seeing, there is a lateral pterygoid plate. So, lateral pterygoid plate forms the medial boundary of the infratemporal fossa. So, medially, we have lateral pterygoid plate. Okay. Now, in the front side, anterior side, now anteriorly, we are seeing this bone. What bone? Maxilla bone. In the back side, posterior side, we are seeing one bone here, a knife-like projection, that is styloid process. Posteriorly, styloid process. Now, what is above? Above, we are seeing this bone, that is our greater wing of sphenoid. And below, the tissue space is open. So, now, so this is our infratemporal fossa boundaries. This infratemporal fossa, and the boundaries are laterally ramus of mandible. We remove that. Medially, lateral pterygoid plate. Okay. And anteriorly, maxilla bone. Posteriorly, we have styloid process. And above, superiorly, we have the greater wing of sphenoid. Greater wing of sphenoid. And below, the space is open. The tissue space is open, which communicate with the tissue spaces around pharynx and esophagus. Around pharynx and esophagus. So now this is the boundary of the infratemporal fossa. Now we're going to see the communications. Now two communications we're going to mark. Now number one, can you see this one? Now here, the one which I marked there, that is our inferior orbital fissure. That is our inferior orbital fissure. So now the infratemporal fossa which communicate with orbit, okay, via inferior orbital fissure. Now one more fissure we have. Now this is our pterygomaxillary fissure. Now again, the pterygomaxillary fissure. So what is the meaning for the word fissure? Fissure means the elongated openings are called fissure. Okay. Now we have a fissure between the maxilla bone and the pterygoid plate. That fissure is called pterygomaxillary fissure. Okay. Pterygomaxillary fissure. Pterygomaxillary fissure, this one. Now pterygomaxillary fissure, if you go inside the pterygomaxillary fissure, now from the infratemporal fossa, you will reach the pterygopalatine fossa. So if you go inside this fissure, then you will reach the, yes, pterygopalatine fossa. So next we are going to write the communications only. So now please write communications of the infratemporal fossa. Communications. Okay. Now communications, it communicates with orbit. The infratemporal fossa communicates with orbit via inferior orbital fissure. Inferior orbital fissure. Number one. Number two, it communicates with pterygopalatine fossa or sphenopalatine fossa. Pterygopalatine fossa or sphenopalatine fossa via pterygomaxillary fissure. Pterygomaxillary fissure. Now it communicates with middle cranial fossa. Middle cranial fossa. I told you the superior boundary is greater wing of sphenoid. Now the greater wing of sphenoid, yes, the inferior view, we see two openings, foramen ovale and foramen spinosum. So it communicates, the infratemporal fossa communicates with the middle cranial fossa through foramen ovale and foramen spinosum. Okay, and below communicates with, below I told you, below it communicates with the tissue spaces around the esophagus and pharynx. Okay. Now these are the communications of the infratemporal fossa. Okay. Right. Now what are the contents? Now the contents are now the pterygoid muscles, mandibular nerve, content of infratemporal fossa, and the second part of maxillary artery and otic ganglion, cauda tympani nerve, and last one, pterygoid venous plexus. Pterygoid venous plexus. So these are the contents of the infratemporal fossa. So now here in this module, we're going to discuss, yes, the muscles of mastication. Pterygoid muscles, masseter temporalis will discuss. Mandibular nerve we discuss. Otic ganglion we discuss. See, maxillary artery altogether we discuss in the pterygopalatine fossa, sphenopalatine fossa. Okay. So now, first thing we're going to discuss the muscles of mastication. So now we're going to start the discussion about the muscles of mastication. So we have four muscles of mastication: temporalis muscle, masseter, pterygoid muscles, medial and lateral pterygoid muscle, medial and lateral pterygoid muscle. So these four muscles. Now all the muscles of mastication are coming from first arch, that is the mandibular arch, and they are supplied by which nerve? They are supplied by mandibular nerve. Okay, so it's understood. Again, now we see one by one. First, we start with temporalis muscle. Now, the temporalis muscle origin from temporal fascia and the temporal fossa. So, the temporal fossa, I told you above the temporal line, below zygomatic arch. There is a temporal fossa. Now, temporalis muscle takes origin from the temporal fossa and the fascia over the muscle, temporal fascia, that provide origin for temporalis muscle. So, temporalis muscle origin from temporal fossa and the temporal fascia. Yes. Now, insertion. Now, I told you the upper part of the ramus having two parts. One is head of the mandible and another one is a coronoid process. So, insertion to the coronoid process. To the coronoid process. Insertion. Right. Nerve supply, mandibular nerve. Anterior division of mandibular nerve will give a branch to temporalis muscle. Okay. Now, nerve supply we discuss in the mandibular nerve topic separately. So, don't bother about the nerve supply now. Now, if you remember, they are supplied by mandibular nerve now. That is well and good. That is more than enough. Okay. Now, what is the action? That is what we have to know. Now, what is the action of temporalis muscle? See, if you want to know the action of any muscle, please remember this basic. The origin point is a fixed point. Insertion point move towards the origin point. So, if you draw the line from the insertion point towards the origin point, now that will give the action of any muscle. Okay. Now, see the diagram. Now, in the diagram, I told you the temporalis muscle attached to the coronoid process, origin from the temporal fossa. So, we have to draw the line from insertion point towards the origin point. Now, see the mandible. Now, mandible, it is moving in the which side? Anterior or posterior or superior or inferior? Moving superiorly. Mandible is moving superiorly. Moving superiorly. That is called elevation. Okay. So, we'll write in the box. So, we have four movements. Moving superiorly. That is called elevation. Moving inferiorly. That is called depression. Moving in the front side, anteriorly. Moving in the front side. That is called protrusion. And moving on the back side, posteriorly. That is a retraction. Okay. So, please remember these four actions. Okay. So, now see the diagram. So, in the diagram, yes, mandible is moving superiorly. So, what is the action of temporalis muscle? Now, action number one, elevation of the mandible. Elevation of the mandible. First action. Now, second one. Now, see these fibers. Now, these fibers, they move the mandible towards the back side. So, these muscles, they move the mandible on the posterior side. This is posterior side. So, mandible also moving posteriorly. So, moving posteriorly, that is called retraction. Retraction of mandible. So, what is the action of the temporalis muscle? We have two actions, elevation and number two, retraction. Okay. Now, out of these two, what is the best action for temporalis? In the exams, they will ask you the single best answer only. So, temporalis muscle, best action is elevation greater than retraction. Okay. Temporalis muscle, best action, elevation greater than retraction. Okay. Right. That's all about the temporalis muscle. Next muscle, masseter. Now, please write masseter muscle origin. Masseter muscle origin from the zygomatic arch. So, again, we are seeing the side view of the skull. Now, origin from the zygomatic arch. Okay, insertion. See, this muscle is inserted to this ramus part outer surface. So, insertion to outer surface of ramus of mandible. Okay, so what is the action of this muscle? So, we have to draw the line from the insertion point and move towards the origin point like this. Okay, so now what is the action? So, ramus is moving towards zygomatic arch. So, ramus of mandible moving superiorly. Okay, so moving superiorly, that is called elevation. So what is the action of this muscle, masseter muscle? Elevation of mandible. Okay, elevation of the mandible. Please remember, masseter muscle is the best muscle for the elevation. It is a strong elevator of the mandible. The best muscle for elevation is our masseter only. Why, sir? See, in the outer surface of ramus, we see some rough impressions. See, in the bone, wherever you see the rough impressions, now these rough impressions on the bone giving the clue that muscle is a powerful muscle, a strong muscle for the particular movement. These muscle fibers, they are very strong, and by their action, by their pull, they leaving a strong impression, the rough impression in the bone. Okay, so the point is, wherever you see rough impression in the bone, and that muscle, that impression given by the muscle due to strong force, so that muscle is the powerful muscle for the particular action. So in the outer surface of the ramus of mandible, we see the rough impression. That means that muscle is the best muscle for the particular action. Okay, so the masseter muscle is a best muscle for elevation, a strong muscle for elevation. Why? Because it is leaving the rough impression in the bone. Okay, right. So that's all about the masseter muscle. Next, we have pterygoid muscle. We have two pterygoid muscles. What are those? Lateral and medial pterygoid muscle. Okay, so we have two pterygoid muscles, lateral and medial pterygoid. Now, please remember, both the pterygoid muscles, they take origin from lateral pterygoid plate. We have one more origin. We'll see that later, don't worry. Now, both pterygoid muscles, they take origin, one of the origin is from lateral pterygoid plate. Sir, why we have to know this, sir? Because we also have medial pterygoid plate. Now, in the exam, they will confuse you. The lateral pterygoid plate will give origin to lateral pterygoid muscle. Medial pterygoid plate will give origin to medial pterygoid muscle. Likewise, they'll confuse you. That is wrong. Now, both pterygoid muscles, they take origin from lateral pterygoid plate. Lateral surface of lateral pterygoid plate give origin to lateral pterygoid muscle. Medial surface of lateral pterygoid plate will give origin to medial pterygoid muscle. That is the point. Clear? Right. Now, we see one by one. First, this is the lateral pterygoid plate. See the diagram. So, lateral pterygoid plate, now this is the outer surface, that is the lateral surface. I am writing as lateral, and this is the medial surface. Okay, so this is what I told you. The lateral pterygoid plate, lateral surface, give origin to lateral pterygoid muscle. Medial surface of lateral pterygoid plate will give origin to medial pterygoid muscle. Okay, and please remember, the medial pterygoid plate is underline and then write, which do not give origin to pterygoid muscle. Okay, so medial pterygoid plate is not giving origin to pterygoid muscle. That is the point. Okay, now see the lateral pterygoid muscle. The lateral pterygoid muscle origin, the upper part of the muscle is taking origin from the infratemporal crust in the sphenoid bone. Infratemporal crust in the sphenoid bone, in the greater wing of sphenoid bone, you see the one small crust there. That is a crust where the upper part of the lateral pterygoid muscle take origin. Infratemporal crust in the greater wing of sphenoid bone. Now, the lower part of the muscle takes origin from the lateral surface of lateral pterygoid plate. Lateral surface of lateral pterygoid plate. That is the origin. Now, see the insertion point. See, muscle fibers, they are horizontal. So, the upper fibers are lower fibers after the origin. The fibers are horizontal, and which is attaching to, inserted to the head of the mandible. So, insertion, the muscle fibers are attached to the head of the mandible. Okay, right. And after attaching to the head of the mandible, some muscle fibers, they also attaching to the disc, articular disc present between the mandibular fossa, the head of the mandible. So, muscle fibers, they also attaching to articular disc that is present between the mandibular fossa, the head of the mandible. And after that, some muscle fibers, they also blends with the capsule of the temporomandibular joint. See, covering this mandibular fossa and the head of the mandible, we have the capsule of temporomandibular joint. Now these muscle fibers, they also attaching to the capsule of the temporomandibular joint. Okay, this is insertion point. Again, this muscle attaching to the articular disc, and that is a question we got in 2023 NEET exam. Okay, right. Now, what is the action? See, action, I told you, the origin point is a fixed point, insertion point, move towards origin point. Now, these muscle fibers are horizontal. See the direction? The muscle fibers are horizontally oriented. Now, the head of the mandible, it is moving in the front side like this. Now, the insertion point, head of the mandible, and it is moving in the front side like this, towards the origin point. Now, this is anterior side. So, mandible is moving in the front side. Okay, so what is action? Moving anteriorly, that is called protrusion. So, action, number one, protrusion of the mandible. Mandible is moving in the front side. Okay, now because of protrusion, the head of the mandible is losing the supports of the ligaments of temporomandibular joint. See, mandible is moving in the front side. Now, because of this protrusion, the head of the mandible is losing the supports of ligaments of temporomandibular joint. Now, the gravity is waiting for this chance only. What the gravity will do? Now, the gravity easily now pull the mandible down. Mandible is moving inferiorly. Mandible is moving in the front side and losing the support of ligaments. Now, the gravity, yes, pull the mandible down. So, mandible is moving inferiorly. That is called depression. So, now we have two actions for the lateral pterygoid muscle. Number one, protrusion. Number two, depression. Now, out of these two, what is the best action? The lateral pterygoid muscle, best action is depression of the mandible greater than protrusion. Greater than protrusion of the mandible. Okay? Depression greater than protrusion. And please remember, it is the only muscle for depression of the mandible. The only muscle which depress the mandible. Which muscle, sir? Our lateral pterygoid muscle. Lateral pterygoid muscle. Okay? Right. That's all about the lateral pterygoid muscle. And now we're seeing the medial pterygoid muscle. Now, medial pterygoid muscle. Yes, origin. Now we have superficial fibers and deep fibers. The superficial fibers, see the diagram? The superficial fibers, they take origin from the tuberosity of the maxilla bone, the tuberosity. So, superficial fibers origin from maxilla tuberosity. Okay, and the deep fibers, they take origin from, again, the lateral pterygoid plate, medial surface of lateral pterygoid plate. Okay, what about the insertion? See, insertion. Now, these muscle fibers, they attach go to the inner surface of the ramus, posterior inferior aspect of the ramus, and also to the angle of mandible inside. Okay, so muscle fibers attached to posterior inferior part of ramus of mandible and also to the angle of mandible. Again, from the mandibular foramen and in the front side, mylohyoid groove. As high as mandibular foramen, and as front as we have the mylohyoid groove. That is a line, demarcating line. Right. So, this is insertion of the middle pterygoid muscle attached to the inner surface of ramus of mandible and also to the angle of mandible. And the specific demarcating line is now mandibular foramen above, and in the front side we have mylohyoid groove. So, already we marked this area in the osteology part. So, the point is, just remember this muscle attached to the inner surface of the ramus of mandible, the posterior part, posterior inferior aspect of the ramus of mandible. So, ramus of mandible, outer surface of ramus masseter muscle, the inner surface of the ramus of mandible, middle pterygoid muscle. Okay, outer surface masseter, inner surface middle pterygoid. If you remember this, that is more than sufficient. Okay. So I'm writing the exact line of insertion. Right. Now what is the action? Now see the muscle fibers. Now the muscle fibers, they move the mandible like this. So mandible, it is moving like this. Now this is the origin point. See my left hand, this is origin point and this is insertion point. Okay. So now mandible, the insertion point move towards origin point. See, mandible is moving in the front side. Origin point is front side. So insertion point on the back side. Posterior inferior aspect of the rhombus of mandible. So the mandible, it is moving in the front side. Protrusion. Again, see the origin point. Origin point is above, insertion point is below. So now mandible also moving superiorly. So now we have two actions for the middle pterygoid muscle. Mandible is moving superiorly and anteriorly. Elevation and protrusion. Okay. So this muscle is moving the mandible in the front side and also superiorly. So what is the action? Number one, elevation, and number two, protrusion. So two actions are there for the middle pterygoid muscle. Again, what is the best action? Elevation greater than protrusion. Okay. Right. These are the four muscles of mastication and their action. So now we're going to summarize this information and we're going to write the best muscle for each movement. Okay. Number one, the best muscle for the elevation of the mandible. Elevation of the mandible. The best muscle is masseter. That is the best muscle. Greater than temporalis and medial pterygoid muscle. Okay. The only muscle which depresses the mandible. Depression of mandible is done by only one muscle. Which muscle? Lateral pterygoid muscle. Okay. Protrusion is done by. See, protrusion is done by two muscles. Lateral pterygoid and middle pterygoid. The pterygoid muscles do protrusion. And what is the best muscle for protrusion of the mandible? Lateral pterygoid greater than middle pterygoid. And the retraction of mandible done by temporalis. Okay, right. So these are the actions and the best muscle for each action. Okay. So we're going to see the animation for the muscles of mastication. Yes. Now we're going to remove the skin, fascia, everything, so that we are seeing the muscles of mastication. So now we are seeing two muscles here. Yes. Now the muscle, this is our masseter muscle, and the muscle coming from this side, that is the temporal fossa, temporalis muscle. Now this is the masseter muscle. Masseter muscle coming from this arch, zygomatic arch. Okay, and inserted to this bone here, that is outer surface of the ramus of the mandible. Okay, now what is the action of the masseter muscle? See here, masseter muscle, it is an elevator. It is elevating the mandible. See, it is elevating the mandible. Yes, the elevation of the mandible, that is the main action of the masseter muscle. Okay, strong elevator. Now next, our temporalis muscle. Now temporalis muscle is arising from the temporal fossa. Now temporalis muscle, which is inserted to coronoid process. So now we will remove this zygomatic arch so that you can see the insertion clearly. See there? Yes, that is the insertion point of our temporalis muscle inserted to coronoid process. Origin from temporal fossa, insertion to the coronoid process. Yes, now what is the action? The mandible will move towards the origin point. Again, mandible is elevating. See the action? The mandible is elevating. Elevation of the mandible. See here? Again, elevation of the mandible. Elevation of the mandible. Elevation main muscle, this fellow only, masseter only. Main elevator, chief elevator, prime elevator, masseter muscle. Temporalis muscle also do elevation. Now the temporalis muscle also do retraction. See here? The mandible is protruded. Now temporalis muscle will retract. The mandible is going on the back side. So temporalis muscle will do retraction also. Two actions are there for our temporalis muscle. Okay. Right. So now we're going to remove the temporalis muscle. And we're going to cut the mandible bone. Here, we're going to remove the mandible bone. Now, if you remove the mandible bone, then you can see the, yes, our pterygoid muscles clearly. Our lateral pterygoid muscle and this is our middle pterygoid muscle. So first, we're going to see the lateral pterygoid muscle. So now we isolate the lateral pterygoid muscle. Now this is our lateral pterygoid muscle. Okay. Now lateral pterygoid muscle origin we know that muscle is coming from the sphenoid bone and also from the lateral pterygoid plate. Now can you see the plate there? That is our lateral pterygoid plate. Yes. That is the lateral pterygoid plate. We are seeing clearly there. Origin from sphenoid bone but also from the lateral pterygoid plate. Now the muscle is inserted to the head of the mandible. Now what are the actions of a lateral pterygoid muscle? Lateral pterygoid muscle will do two actions. It is the only muscle which depresses the mandible, opens the jaw, main action. The other action is, see here, the mandible is moving in the front side. Mandible is moving in the front side like this. Okay, mandible is moving in the front side. That is a protrusion of the mandible. Okay, now these two are the actions of our lateral pterygoid. Number one, protrusion, depression. Now out of these two, which is the best action? Depression greater than protrusion is the only muscle which opens the jaw, lateral pterygoid muscle. Now next we are seeing the medial pterygoid muscle. Now the medial pterygoid muscle again have two origins. One is from the lateral pterygoid plate and another one is from maxilla bone. See here, we are seeing the origins of our medial pterygoid clearly there. One is from maxilla bone. See there, one is from maxilla bone and another one is from the lateral pterygoid plate. Now see the attachment. The muscle is inserted to the inner surface of the ramus of mandible. Right. Now what is the action of our medial pterygoid muscle? Now see the action here. Now the mandible is, yes, elevated, elevation of the mandible. And also see here, mandible is moving in the front side. The medial pterygoid muscle will do protrusion of the mandible and also the elevation of mandible. Out of these two actions, now what is the best action of medial pterygoid? Very good, elevation greater than protrusion. For lateral pterygoid, depression greater than protrusion. Medial pterygoid, elevation greater than protrusion. Now these are the four muscles of mastication and their actions. Right. So now see the diagram. We're going to see some sections. Now this is the frontal section of the head. So the head, we have taken the frontal section. And that is one muscle which is coming from this side. And then coming down to the mandible. So what is the muscle marked here? That muscle is a temporalis muscle. So that's a temporalis muscle. Okay. So what is the best action of temporalis muscle? Elevation greater than retraction. Now see this diagram. Now in this diagram, yes, we are seeing the inferior view and we have taken the section at the level of tongue. This is tongue. I'm writing as T. In the front side, we are seeing this bone. That is the body of the mandible. In the front side, we are seeing the body of the mandible. This one, the inferior border. Now from here, you see one small extension here. What is that? Now this is the inferior border of the body of the mandible. From here, you see the extension. What is this? Ramus of mandible. So this is our ramus of mandible. That is our ramus of mandible. Okay. Now ramus of mandible. If that is a ramus of mandible, I'm going to mark this is number 1 and this is number 2. Now what is 1 and 2? The first muscle, number 1 muscle attached to the inner surface of the ramus of mandible or posterior inferior aspect of the ramus of mandible. Which muscle? Our medial pterygoid muscle. And number 2, outer surface of the ramus of mandible. Which muscle? Masseter muscle. Okay. So outer surface of ramus of mandible, masseter, posterior inferior aspect of the inner surface of ramus of mandible and up to the angle of mandible. That is our medial pterygoid muscle. So I told you, just remember inner surface of ramus of mandible, medial pterygoid, outer surface of ramus of mandible, masseter muscle. Okay. Right. So medial pterygoid muscle, just remember attached to inner surface of ramus. Again, no need to know the exact insertion for medial pterygoid. Just remember inner surface of ramus of mandible, medial pterygoid. That is more than sufficient. Okay. Outer surface of ramus of mandible, masseter. Now again, the exams, they will mark any of this muscle and they will ask you the action of the muscle. Okay. Right. So that's all about the muscles of mastication. So we have 4 muscles. We know the origin, we know the insertion, we know the action. Now supply, we see the mandibular nerve. Okay. Now these muscles of mastication are supplied specifically by the anterior division and the trunk of the mandibular nerve. That we'll see in the mandibular nerve discussion topic. Okay. So now we're going to start the mandibular nerve, the another content of the infratemporal fossa. So we discussed mandibular nerve, and otic ganglion side by side, and we also discussed chordae tympani nerve. Okay, so we're going to draw one diagram. So we're going to draw the mandibular nerve. Right, now this is our trigeminal ganglion. This is the sensory root of, that is the sensory root of trigeminal nerve, which expands to form trigeminal ganglion. That is our trigeminal ganglion. Now the trigeminal ganglion, which gives three branches: ophthalmic, maxillary, and mandibular. This is ophthalmic branch, maxillary, and mandibular branch. Now the mandibular nerve, the sensory root is coming from the trigeminal ganglion. I am writing as SR. That means the sensory root of mandibular nerve is coming from trigeminal ganglion. See, ophthalmic nerve and maxillary nerve, they are sensory nerve. They are purely sensory. Okay, whereas the mandibular nerve is a mixed nerve, which carries sensory fibers and also motor fibers. So the motor root for the mandibular nerve is coming from directly from pons. There's a motor root. That motor root is coming directly from pons. So this is the motor root. It is coming directly from pons. Now both the roots, they passes through foramen ovale and they join together to form the trunk of the mandibular nerve. So they form the trunk of the mandibular nerve. So the trunk of the mandibular nerve is formed by joining of the sensory root and the motor root. Okay, right. Now see the diagram. Now in the diagram, we are seeing the sensory root of trigeminal, which expands to form the trigeminal ganglion. The trigeminal ganglion is having three subdivisions: ophthalmic, maxillary, and mandibular. And we also have the motor root, which is coming directly from pons, and both the roots, they pass us through this opening, and that is our foramen ovale. Okay, and both the roots, they join together to form the trunk of the mandibular nerve. Yes, that is what we are saying. Now, the trunk of the mandibular nerve, which gives attachment to one ganglion. What is that? That is our otic ganglion. That is our otic ganglion. Okay, so the trunk of the mandibular nerve gives attachment to otic ganglion. Fine. Now, otic ganglion is a parasympathetic ganglion. Okay, so now for any parasympathetic ganglion, we have 4 points. Number 1, topographical attachment. Number 2, functional attachment. Now, what are the glands, muscles supplied by the ganglion? And number 4, and what is the pathway? How it is supplying the gland or muscle? Only 4 points for the parasympathetic ganglion. Again, we have 4 parasympathetic ganglion: otic ganglion, submandibular ganglion, the pterygopalatine ganglion, and the ciliary ganglion. From the parasympathetic ganglion, we are getting questions in the recent exams. Okay, so now we have the otic ganglion, the parasympathetic ganglion, that is attaching to the trunk of the mandibular nerve. So anatomically, topographically, otic ganglion attached to the, so please write the heading, otic ganglion. So topographically, anatomically attached to which nerve? Topographically, the otic ganglion attached to mandibular nerve. But I told you in the discussion of the functional columns of the cranial nerve nucleus, I told you one point: fibers from the inferior salivary nucleus are given to otic ganglion. From otic ganglion, fibers are given to parotid gland. I told you the 9th nerve, glossopharyngeal nerve, carry the fiber from the inferior salivary nucleus to otic ganglion. Yes or no? Yes. So the otic ganglion attached to which nerve? Functionally to which nerve? Glossopharyngeal nerve. So functionally, otic ganglion attached to glossopharyngeal nerve. Okay. So topographically, mandibular nerve. Functionally to the glossopharyngeal nerve. Now, what are the glands supplied by the otic ganglion? Otic ganglion supplies only one gland, parotid gland. So otic ganglion supplies the parotid gland, which is concerned with supply of parotid gland. And we're going to trace the pathway. Now, before that, we're going to write the relations of OT ganglion. 2015 AIMS exam, we got the question, very old question, but still it is a worth to note. I told you, come to the diagram. This is OT ganglion. Okay. So, this is a medial side. Medially, we have a muscle. We have one muscle just medial to the OT ganglion. Now, this muscle is tensor palatini muscle. And behind the OT ganglion, I am drawing in dotted line. That is our middle meningeal artery. So that means they are posterior. That is our middle meningeal artery. Okay. Now, what is the relation of OT ganglion? Now, medial to OT ganglion, we have one muscle. Which muscle? Tensor palatini muscle. Lateral to OT ganglion, the trunk of mandibular nerve. Above the OT ganglion, we have foramen. What foramen? Foramen ovale. And behind the OT ganglion, I have drawn one artery, dotted line. What is that? Middle meningeal artery. Yes, very good. And that is a boundary for, that is a relation of OT ganglion. Okay. So, OT ganglion relation. So, medially, we have a muscle. What muscle? Tensor palatini muscle. Laterally, the trunk of mandibular nerve. And above, foramen ovale, and behind, middle meningeal artery. Middle meningeal artery. Okay, this is the relation of OT ganglion. Okay, right. So now only one thing is pending. We're going to trace the pathway. Before that, yes, see the diagram, actual diagram. Now this is the trunk of the mandibular nerve. Now trunk of the mandibular nerve is giving attachment to OT ganglion. Now this is medial side. So medially, tensor palatini muscle, and laterally, the ganglion attached to the trunk of the mandibular nerve. Above, foramen ovale. This one, this is the foramen ovale. Above, and behind, we have the middle meningeal artery. Middle meningeal artery will be passing in the foramen spinosum like this. That is the middle meningeal artery. Okay, right. Now, what is the parasympathetic pathway? We have to trace from the nucleus. So now, the parasympathetic pathway for the parotid gland. Parasympathetic pathway. We have to start from which nucleus? Inferior salivatory nucleus. We have to start from inferior salivatory nucleus. Now, fibers from inferior salivatory nucleus are given to glossopharyngeal nerve, ninth nerve. From glossopharyngeal nerve, the fibers are given to the tympanic branch of glossopharyngeal nerve. Again, from there, the fibers are given to tympanic plexus. Okay, so from tympanic plexus, lesser petrosal nerve carry the fiber, and the lesser petrosal nerve give the fiber to otic ganglion. Now, these are all the preganglionic parasympathetic fibers. They are present, yes, before the ganglion. Preganglionic parasympathetic fibers to the otic ganglion. Ninth nerve, the tympanic branch of ninth nerve, tympanic plexus, lesser petrosal nerve. Okay, and fibers are given to otic ganglion. Now, from otic ganglion, the fibers are carried by auriculotemporal nerve, and auriculotemporal nerve, which in turn carry the fiber to the parotid gland. Okay, so auriculotemporal nerve carries what type of fiber? Please remember, which carry the fiber from the ganglion to the gland, after the ganglion. So it is post-ganglionic parasympathetic fiber. From which ganglion? Otic ganglion. To which gland? Parotid gland. So these structures are specific to one another. They will give you any one of these structures and they will ask you the other. Okay. So auriculotemporal nerve carries post-ganglionic parasympathetic fiber from the otic ganglion to the parotid gland. Clear? Right. So see the diagram. Now this is the fiber from inferior salivatory nucleus From there, fibers are given to glossopharyngeal nerve, and then tympanic branch, tympanic plexus, lesser petrosal nerve. Up to that, yes, preganglionic parasympathetic fibers. And then fibers are given to otic ganglion. So from the otic ganglion, auriculotemporal nerve carry the fiber to the parotid gland. Right. Now we're going to see the applied. What is that? Frey syndrome. Now in Frey syndrome, auriculotemporal nerve damage during parotid surgery. Okay. Now the fibers regenerate. The auriculotemporal nerve fibers regenerate, and they supply the sweat glands instead of parotid gland. That is called Frey syndrome. So Frey syndrome is due to involvement of which nerve? Auriculotemporal nerve. Okay. So what is Frey syndrome? Gustatory sweating. The auriculotemporal nerve will regenerate. Instead of supplying the parotid gland, the regenerated fibers of auriculotemporal nerve supply the sweat glands. So when the patient eats something, instead of getting secretion from the parotid gland, the patient have a sweating over here. And this is called Frey syndrome or gustatory sweating. Okay, right. That's all about the otic ganglion. Okay, right. So now we know the formation of the trunk of the mandibular nerve. Now from the trunk of the mandibular nerve, we have attachment to otic ganglion. So now we come back to the mandibular nerve. Now we're going to discuss what are the branches from the trunk of the mandibular nerve and how the trunk of the mandibular nerve going to divide. We're going to see all this. Okay. Now we're going to continue the diagram. Now this is the trunk of the mandibular nerve. This is a foramen ovale. Now from the foramen ovale, yes, the trunk of the mandibular nerve is coming out like this. And I told you just now, the trunk of the mandibular nerve, which is giving attachment to otic ganglion. Yes. Now, this is the trunk of the mandibular nerve. Now, from the trunk of the mandibular nerve, we have one fiber. That fiber is nerve to medial pterygoid. Nerve to medial pterygoid. See, nerve to medial pterygoid, yes, that is the fiber coming directly from the trunk of the mandibular nerve. Very important. The only muscle of mastication which is supplied directly by the trunk of the mandibular nerve. Which muscle? Medial pterygoid muscle. So nerve to medial pterygoid, it is a branch from trunk of the mandibular nerve. So medial pterygoid muscle, it is the muscle get the nerve supply from the trunk of the mandibular nerve. Okay. Now nerve to medial pterygoid, after supplying medial pterygoid muscle, the fibers goes to otic ganglion. Now fibers from the otic ganglion without any relay supplies two more muscles. What are those? One is tensor palatini muscle and another one is tensor tympani muscle. So tensor palatini muscle, tensor tympani muscle, these two muscles get the nerve supply from nerve to medial pterygoid. Clear? So nerve to medial pterygoid supplies the medial pterygoid muscle. After supplying medial pterygoid muscle, the nerve to medial pterygoid also supplies tensor palatini muscle and tensor tympani muscle. Is that clear? Shall we proceed? So nerve to medial pterygoid supplies medial pterygoid muscle and tensor palatini and tensor tympani muscle. Now see the diagram. Now in this diagram, yes, we are seeing the trunk of the mandibular nerve. This is the trunk of the mandibular nerve. The trunk of the mandibular nerve which gives a branch to the medial pterygoid muscle. There is a medial pterygoid muscle which is supplied directly by the trunk of the mandibular nerve. And this nerve, after supplying medial pterygoid muscle, the fibers go to otic ganglion without any relay, supplies tensor palatini muscle, and which also gives a branch to tensor tympani muscle. Tensor tympani is a muscle in the middle ear muscle. Okay. So nerve to medial pterygoid supplies three muscle: medial pterygoid muscle, tensor palatini, and tensor tympani muscle. Okay. And the trunk of the mandibular nerve also gives a meningeal branch of mandibular nerve. Now meningeal branch of mandibular nerve also known as nervi spinosum. Nervi spinosum. There is a meningeal branch of mandibular nerve which passes through foramen spinosum. Okay, right. That is the meningeal branch of mandibular nerve, otherwise known as nervi spinosum. Now, these two are the branches from the trunk of the mandibular nerve. Okay, and then the mandibular nerve, the trunk of the mandibular nerve, after that, which divide into two branches, anterior division and posterior division. This is anterior and this is posterior division. Okay, so the trunk of the mandibular nerve, which divides into anterior division and posterior division. Clear? Right. Now, the anterior division of mandibular nerve gives 3 motor branch and 1 sensory branch. The anterior division of mandibular nerve gives a branch to masseteric branch. Masseteric branch. This is a branch to masseter muscle. Number 2, deep temporal branch to temporalis muscle. And number 3, pterygoid branch. Pterygoid branch to lateral pterygoid muscle. Lateral pterygoid muscle. Deep temporal branch to temporalis muscle. Masseteric branch, again name itself we have a clue, to the masseter muscle. Now these 3 are motor branches. So anterior division of mandibular nerve gives 3 motor branches to the remaining 3 muscles of mastication. I told you, from the trunk itself, the middle pterygoid muscle get the nerve supply. So remaining 3 muscles get the nerve supply from the anterior division of mandibular nerve. The anterior division of mandibular nerve, which also gives one sensory branch. What is that? Buccal branch. The buccal branch of mandibular nerve, sensory branch. Now this branch pierces buccinator muscle and which carries sensory fibers from the cheek. So the buccinator muscle is pierced by buccal branch of mandibular nerve, not buccal branch of facial nerve. Buccal branch of facial nerve is a motor nerve, okay, which supplies the muscles of face. Whereas buccal branch of mandibular nerve, it is coming from the infratemporal fossa, which pierces the buccinator muscle and carries the sensory fibers from the cheek. Okay, so the point is the buccal branch of mandibular nerve, sensory branch, and that branch pierces the buccinator muscle and carries the sensory fibers from the cheek. Clear? So anterior division of mandibular nerve gives 4 branch, 3 motor branch and 1 sensory branch. Okay. Next, we want to see posterior division branches. So now the posterior division is left out. The posterior division is giving 3 branches. Number 1, auriculotemporal nerve. Number 2, lingual nerve. And it also gives inferior alveolar nerve. So 3 branches we are going to discuss. Right. Number 1, auriculotemporal nerve. That is a branch from posterior division. So please write, the posterior division of mandibular nerve gives 3 branches. Auriculotemporal nerve, number 2, lingual nerve, and number 3, inferior alveolar nerve. Okay, right. Now see the auriculotemporal nerve. The auriculotemporal nerve fibers having the 2 roots, and these 2 roots encircle the middle meningeal artery. So we have 2 roots of auriculotemporal nerve which encircle the middle meningeal artery. This and all they won't ask you. For the completion's sake, I am saying the 2 roots of auriculotemporal nerve which encircle the middle meningeal artery. Okay, and then the auriculotemporal nerve which carries 2 type of fibers. Auriculotemporal nerve which carries general somatic afferent, general sensory fibers. General sensory fibers from the temple and the adjoining area of the auricle. Auricle and temple. The adjoining area of the auricle and temple. So this area, general sensory fibers are carried by the auriculotemporal nerve. So what is the functional column? Which carries what type of fiber? General somatic afferent fibers. Okay, and just now I told you the auriculotemporal nerve also carries postganglionic parasympathetic fibers from the otic ganglion to the parotid gland. So what type of fiber? General visceral efferent fiber, GVE fiber. Okay, so GVE fiber means which carries postganglionic parasympathetic fiber from otic ganglion to the parotid gland. Okay, so organotemporal nerve carries two type of fibers. What are those? Number one, GSA fiber. Number two, GVE fiber. Clear? Right. Now, next, second nerve, lingual nerve. Now, lingual nerve, it is a branch of posterior division of the mandibular nerve. And see the lingual nerve in the infratemporal fossa, which receives chorda tympani nerve. Okay, so please write by the side. So, lingual nerve, which receives chorda tympani nerve in the infratemporal fossa. Okay, right. Now, chorda tympani is a branch of facial nerve. See the diagram. Now, see the second diagram. Now, this is our chorda tympani nerve. Okay. Now, chorda tympani nerve, branch of facial nerve. So, chorda tympani nerve, it is a branch of the facial nerve. Okay. So, now we write some basic points about the chorda tympani nerve and then we proceed to lingual nerve. Okay. So, now this is our chorda tympani nerve. Yes. Now, chorda tympani nerve is a branch of facial nerve which arises just 6 millimeter above the stylomastoid foramen. Now, see the diagram. Now, that is our stylomastoid foramen. So, the nerve arises from the facial nerve 6 millimeter above the stylomastoid foramen. Now, after the origin, the chorda tympani nerve is having the course in the middle ear. Okay, and which emerges from the skull base through petrotympanic fissure. And joins with lingual nerve in the infratemporal fossa. So now we're going to write some basic points for the chorda tympani nerve. So please write by the side the chorda tympani nerve. First point, it is the branch of facial nerve, 6 millimeter above the stylomastoid foramen. After that, the nerve is having course in the middle ear, and then the nerve emerges from the skull base through petrotympanic fissure. And finally, which joins with lingual nerve in the infratemporal fossa. This is the course of the chorda tympani nerve. Okay, right. So now the lingual nerve receives chorda tympani nerve in the infratemporal fossa. Right. Now, after receiving the chorda tympani nerve, now see the lingual nerve. The lingual nerve descends all the way down, and the lingual nerve suspends one ganglion. Which ganglion? Submandibular ganglion. Okay. Now, the fibers from the submandibular ganglion directly supplies the submandibular gland. Okay. The lingual nerve suspends the ganglion directly. Now, from the ganglion, the fibers from the ganglion supplies the gland. After suspending the ganglion, the lingual nerve will go all the way to the anterior two-third of tongue, which carries general sensory fibers from the anterior two-third of tongue. Clear? Now we write the course. Now, yes, the lingual nerve, after receiving chorda tympani nerve, the lingual nerve suspends. Submandibular ganglion. And in bracket, please write fibers from submandibular ganglion supply submandibular gland and also sublingual gland. Okay, fine. Now, after suspending the submandibular ganglion, the lingual nerve reach the anterior two-third of tongue. Now, while reaching the anterior two-third of tongue, the lingual nerve is crossed by one structure. See the diagram. Now, see the lingual nerve. The lingual nerve reaching the anterior two-third of tongue. Before that, which is crossed by one structure. Which structure? Submandibular duct. So, please write the lingual nerve is crossed by submandibular duct, and the lingual nerve reach anterior 2/3 of the tongue. Okay, so lingual nerve carries general sensory fibers from the anterior 2/3 of tongue. Lingual nerve carries general sensory fibers from the anterior 2/3 of tongue, and lingual nerve is receiving caudate tympani nerve, very good, which carries taste fibers from the anterior 2/3 of tongue, which carries taste fibers from the anterior 2/3 of tongue. Okay, right. Shall we proceed? Now the point is, now they gave this question in 2022 NEET exam. The structure affected while removing the submandibular duct, the most common structure which affected while removing the submandibular duct. So what is the structure which is close to submandibular duct? Which nerve? Lingual nerve. So lingual nerve is crossed by submandibular duct before reaching the anterior 2/3 of tongue. So the most common structure affected while removing the submandibular duct. Which structure? Lingual nerve. 2022 NEET exam question. Okay, and we also have one more question, but most of the students, they made a mistake here. What is the structure affected while removing the submandibular gland? While removing the submandibular gland, the answer is not lingual nerve. Now the submandibular gland, it is present, the superficial part of submandibular gland is present just below the platysma. See, if you remove the skin and then you remove the platysma, and just beneath that we see the superficial part of submandibular gland, and there is one nerve which is close to that. Which nerve? That nerve descends along the margins of mandible, marginal mandibular nerve. So the nerve which is close to submandibular gland, superficial part of submandibular gland, is marginal mandibular nerve. Marginal mandibular nerve. So the structure damaged, the structure affected while removing the submandibular gland. Which nerve? Marginal mandibular nerve. The structure damaged or affected while removing the submandibular duct. Which nerve? Lingual nerve. That is why I am saying, see the language of the question properly. See what they are asking. They are asking submandibular duct or submandibular gland. Submandibular duct means lingual nerve. Submandibular gland means marginal mandibular nerve. Okay, right. So that's about the lingual nerve. And we're going to see the second parasympathetic ganglion. In the trunk of the mandibular nerve, we discuss OT ganglion. And now we're going to discuss this ganglion, or ganglion, submandibular ganglion, another parasympathetic ganglion. Very few points are there. I told you only 4 points for each parasympathetic ganglion. So now we're going to discuss submandibular ganglion. Already we know the points. We're going to write, we're going to summarize the information, and we're going to write the points for submandibular ganglion. Now submandibular ganglion topographically, anatomically attached to which nerve? Topographically attached to which nerve? Lingual nerve. Lingual nerve is suspending the submandibular ganglion. But functionally, which nerve? Facial nerve. Now what are the glands supplied by the submandibular ganglion? Glands supplied. 2 glands. What are those? Submandibular gland and sublingual gland. Very good. Now what is the pathway? The parasympathetic pathway for the submandibular gland. Very simple. Superior salivatory nucleus. From here, the facial nerve carry the fiber. Now from the facial nerve, fibers are given to caudate tympani nerve. Now from caudate tympani, the fibers are joining with lingual nerve. Now from lingual nerve, the fibers are given to submandibular ganglion. From submandibular ganglion, the fibers are given to submandibular gland and sublingual gland. Okay, this is the parasympathetic pathway for the submandibular gland and sublingual gland. Now this facial nerve, caudate tympani, lingual nerve, they carries the preganglionic parasympathetic fiber. Now in the exams, they will ask you about caudate tympani nerve. Now what are the fibers carried by the choroid tympani nerve. The choroid tympani nerve carries preganglionic parasympathetic fiber to submandibular ganglion, to submandibular gland and sublingual gland. Preganglionic parasympathetic fiber. So choroid tympani carries what type of fiber? General visceral efferent fiber, parasympathetic fiber. Preganglionic parasympathetic fiber, general visceral efferent. And choroid tympani also carries taste fibers from the anterior two-third of tongue. SVA fibers, special visceral afferent fibers, carries taste fibers from the anterior two-third of tongue. So choroid tympani carries general visceral efferent fiber and SVA fiber, special visceral afferent fiber.